Well, hi there, everyone. This is Dr. Schroder with this week's video introduction to week number 6 of our course in the Principles of Patient and Staff Education. Once again, a very nice week of discussion, a very straightforward week. Only assignment this week was a discussion question, and that discussion question was one of those scenarios that we give that I would call almost an impossible situation. We had this patient, I believe her name was Sherry, who is a patient with chronic schizophrenia. She is going through an acute exacerbation of that schizophrenia. She has a variety of medical needs that are causing stress and are making her schizophrenia worse or causing that exacerbation, as well as the stress that comes with dealing with her children who also have medical issues and asthma and need quite a bit of care. And the question exists is Sherry really able to even take care of her children? And she wants to keep her children. And so we have kind of this impossible task, or a very difficult task, is how do we treat Sherry? What do we do? How do we approach her from a nurse educator point of view? And the discussion here was pretty good. Everybody, I think, pretty much honed in on and really hit the main points. The main thing to remember is that we're dealing with an individual with disabilities. There's a couple things we need to keep in mind. Is one, well, the first thing, and we'll be talking about this a little bit next week as well, but really the main thing is making sure that both Sherry and her children are safe. The first rule of thumb is to make sure that her children have somebody to take care of them. We want to make sure that we assess her closely and carefully to make sure that we can find her appropriate placement or find her appropriate social supports and social resources. Be very important to network with and to work in concert with the case manager or the social worker in this case to make sure that our needs were met as best as they could. Once we know that the immediate need is met or that the safety needs are met, then the focus is on patient education. And when we're dealing with a patient that has any number of disabilities, particularly mental disabilities or developmental disabilities. And I want to be careful here because developmental disabilities and mental disabilities are two totally different things. Somebody who is developmentally challenged or has a low IQ is faced with a different set of issues and challenges than somebody who is mentally ill. People that are mentally ill are not necessarily IQ challenged, and people who are IQ challenged do not necessarily have a mental illness. Matter of fact, in most cases, they don't. But the principles are still pretty much the same. We want to make sure that when we're providing education, that we provide education in a way that the patient will understand. That's, of course, true of any population. But with the mentally ill population, that means that we need to keep the education focused, should be given in short increments. As a general rule, kind of a rule of thumb here is that when you have an individual with mental disabilities, we generally provide more education more often, but for shorter amounts of time, with a focus on memorization and a focus on making sure that they understand keeping things very task oriented. What is it that they need to do? What are the tasks that they need to do? When are their follow up appointments going to be? What are their medication regimen? If they have, medical ongoing issues, what do they need to do? What is the information that they really need to know to be able to do that? And then check back with them frequently to make sure that that's the case. The same would hold true here with assuming that a family member or that a social worker was going to be working with the children. The focus is to try to get Sherry either to allow her the functionality that she can continue to have custody of her children, or to get the custody of her children, reimposed or regained. So that's a primary focus here. So you're really kind of doing almost like 3 layers of education. One layer of education on the mental health needs and the medication she needs for that. Another layer of medication on the physical and the medical needs, and then another layer on parenting skills and assessing all of those things. Really quite a difficult case study, but not one that is terribly uncommon. I'm primarily a mental health nurse, and have dealt with those situations, fairly frequently. So they happen more frequently than I think that any of us would really hoped to think that they would. So again, very good week of discussion. I anticipate that I should have the grading done for that probably on Wednesday. Kind of an easy week of grading because I primarily just have your discussion questions to grade this week. And in week number 6, again, just a discussion question this week. We're going to shift our focus a little bit this week to discuss how do we identify and how do we identify education needs for staff in a hospital or in an organization. So the idea here is that you're a staff developer and that you're working in a state that does not require nurses to get their own CEUs. So what that means is that if that's the case, if you're working in one of those states, then it's really the hospital educator's responsibility to identify the education needs for their unit. And so here we're going to talk about that. How do you identify the education needs? How would you prioritize education on your particular units? Who would you talk to? Who would you network with? What are the important principles to keep in mind here? That's really what the focus of this particular discussion question is. That's pretty much the task that we have. One thing I will say in week number 7, as you're looking ahead, you do have a written assignment. The only thing I'm going to say about the week 7 QSIN assignment right now is you're going to be developing a simulation. Note to please follow the rubric closely because it's a little easy to get misled because you're going to be asked to download a template, and the template is simply a template that is used to develop the scenarios and develop the KSAs or the knowledge, skills, and attitudes required for one of the QSIN competencies and providing a education based on those competencies. Notice that the assignment, however, following the rubric is not just filling out the template. It's a paper that you have to write. You're going to use the template as a guide to help you, but it's not just completing the template. So I just wanted to, as you're planning ahead and as you're looking at that assignment, realize you do have a paper to complete. It's not just filling out a template. I just wanted to give you that information now. So as you're not led astray as you start to prepare for that project. So I look forward to participating in the discussions with you again this week. I've got all of your PEM papers graded, and so each of you has feedback on that. Remember, just from a grading point of view, I do follow the rubrics pretty closely. So if you adhere to the rubric and if you follow the criteria in the rubric, you'll probably do pretty well. If anything in a rubric seems unclear, anything in assignment seems unclear, please let me know. I'd be more than happy to clarify for you exactly what the expectation is. So I look forward to participating in a discussion with this week. I look forward to another great week of discussion, and we'll see you in the discussion forums.